Go. Hey, everybody. Dr. Phillips, back for our Tuesday 12 Minutes to Health. I just wanted to start out this 12 Minutes to Health by saying thank you and just showing everyone a little bit of gratitude. We've had a really great response to the past, I guess this is 10 weeks of doing this now. Just the overwhelming response we've gotten from family and friends and most importantly, patients and people in the community just saying thank you for doing what we're doing and talking about the research and just helping people stay healthy. Having people in the clinic. I know there's a group in there tonight in each clinic. I always encourage you guys, come into the clinic on these Tuesday nights. It's free. You get to hang out with other people who are also interested in health and trying to learn what the research has to say and how it can help them be healthy. We have healthy refreshments. I know we had some gluten-free muffins made today, some gluten-free cookies in there. There's fruits, vegetables, dips, just all kinds of hors d'oeuvres, green smoothies. I mean, a couple weeks ago I was in there, I didn't even have to eat dinner afterwards. I just snacked in there and answered some questions. So, and I think that's the most important part, right? Not outside of the refreshments is the fact that the doctors are in there for you. And they're there to answer the questions for you that you may have following something like this. As always, you can enter questions on Facebook too, and we'll try to get to those as well. But it really is a huge benefit being in the office and being able to talk to the doctors after we finish up the talk. So you can get your questions answered and make sure that you don't leave without knowing everything that you want to know about your health and what it takes to be healthy. So with that being said, thank you guys. I really do appreciate the response so far, but let's go ahead and jump into the research here. I'm going to go ahead and share my screen with you. Give me just a second. There we go. All right, so as always, we do our best to bring you the best research that's out there, right? All too often, especially right now, with everything that's going on, we get the word research and the word science is being thrown around like crazy. And a lot of times it's just opinion, right? The opinion of a scientist is still not science until it's proven. So it's just an opinion. But we throw those words around very loosely, and especially in our current situation. But so that's why we are so committed to making sure that we dig through this research. First of all, make sure that it is good research, that it's done correctly, that it's not done poorly and just getting the outcomes that they need for some sort of marketing or sales gimmick. We do just peer-reviewed randomized control trials for you guys. We will do the reviews of the randomized control trials from time to time, like tonight is a big review, and I'll explain that in a minute. But that allows it to be unbiased. So you don't get my opinion. You're just getting the facts, and you're getting an evidence-based approach to health. And that is our commitment to you every single week that we do this. So let's go ahead and get started with tonight's report. All right, so tonight, like I said, this is kind of a landmark study for chiropractic dealing with low back pain. It was Dr. Manga and some other people, about 4 other people, that created the Manga report in 1993. So this was done up in Canada, and the health board in Canada commissioned Dr. Manga because they have universal health care for everyone up there, right? So it's coverage for everybody. But what they realized is they were spending way too much money, and they didn't know why or how. So they wanted to look at low back pain because they did the research and they found out that they were spending a ton of money on low back pain, and it was the #1 cause of missed work in Canada, and it had huge effects on morbidity and just overall decreasing the quality of life of the people in Canada. And like I said, they're spending a ton of money on it, so they commissioned Dr. Manga to do this report and see, okay, is it better to go a medical route and have a medical doctor manage low back pain, or should we go a chiropractic route and have a chiropractor manage low back pain? So he dug through all the research. This report is over 300 pages long. It's quite a read. There's a lot there, so I'm going to try to sum it all up for you. And this isn't the first time that this has been done. Okay, this was, if you look in, let's see, it was really early on, there was the Wilkes trial in the United States. Hold on, I had a little problem there. I apologize. Let's see. There we go. So there was the Wilkes trial. The Wilkes trial was early on in the United States when chiropractic was coming around. The American Medical Association put together a group of people to eliminate chiropractic. They put together a committee to eliminate chiropractic. Well, this ended up, chiropractors fought back. It ended up going to trial, and they commissioned a report to see, is chiropractic, because the claims that were being made was that chiropractic's unscientific, that it's ineffective, that if you don't believe in it, it doesn't work. They're just stealing money from patients. So they put this group together to find out, is this really the case? And what they found out is, no, this is not the case. Okay. So with that not being the case, the trial was won by the chiropractors, and that committee had to be dispersed, and they weren't allowed to try to eliminate chiropractic anymore. The same thing happened in New Zealand in the New Zealand inquiry. They were much like Canada, trying to figure out, why are we spending so much money on these issues of physical pain and things like that. So they went through the research, and they too found out that chiropractic was actually safer, more effective, and more cost effective, which we'll get into in the research tonight. And that's exactly what the Manga report shows as well. So I said a couple of things there. I said it was safer. These are direct quotes from the literature here. It says, our reading of the literature suggests that chiropractic manipulation is safer than medical management of low back pain. And it goes on to say, which I didn't put on here, but it goes on to say that there are a lot of side effects with medications, and they found 0 side effects with chiropractic adjustments performed by chiropractors. Now, they did find some people who were doing some manipulations that were not chiropractors, and there were some injuries and things like that at a much higher rate than with chiropractors. So they suggest sticking with a chiropractor if you're having manipulation done to your spine. But what they don't suggest is sticking with the usual medical route, which is pain pills, surgeries, injections. They found that they cost a lot more. There's a ton of side effects, and they're just not as effective as chiropractic care. And that makes sense, because chiropractic care focuses on creating motion and creating movement. If your joints aren't moving correctly, you're going to build up scar tissue, you're going to build up inflammation, and you're going to eventually have pain because there is no motion in there. And when there's no motion, you're going to get pain. So chiropractic puts motion back into the joints, something that no drug, no surgery, and no injection will ever be able to do. So that's why they're ineffective. Ultimately, you can eliminate pain for a little bit, but you're not causing the problem or fixing the problem of no motion. So we've got to have motion in order to be healthy. We are always talking about eat well, move well, and think well. That's the move well portion. It goes all the way down to a single joint level. And we've got to keep all those joints moving correctly if we're going to stay pain-free. So they showed that chiropractic was actually the way to go for that. The next thing I talked about was more effective. So the Workers' Compensation Union, they did their own study, which made it into this report. And what they found out is that people that had the specific injury of low back pain, and that was the diagnosis, they had those that went to chiropractors and those that went to medical doctors. What they found out is those that went to medical or to chiropractors returned to work much sooner. All right, so they're getting back to work because they're getting motion back in their joints, and then pain's going away. So it was happening much sooner when you see a chiropractor than when you see a medical doctor. Because when you would see a medical doctor, they would have, a decrease in pain for a little bit, but it would come back. They'd wake up achy. They'd wake up stiff. They couldn't make it back into work. They'd go for a couple of days on painkillers, and then it'd just be a cycle that they got into, and they'd be missing more work. So with chiropractic, they noticed that cycle wasn't happening. I talked about it being more cost effective, right? In the Manga report, they said there would be highly significant cost savings for the country of Canada if more management of low back pain was transferred from medical physicians to chiropractors. There were hundreds of studies on the costs of this stuff. And what they found out was that when we get motion into the joints and we start getting adjusted, that you maintain your health and you maintain that lack of pain longer. And it's just so much cheaper to get adjusted than it is to continually be buying medication after medication after medication. And thrown on top of that, the fact that the medication just isn't working. It's not creating motion. It never will. So it can't do what chiropractic's going to do. And then the side effects, which can be devastating. We've seen the opioid crisis the past couple of years here in the United States, and And it's devastating to people, the side effects that are there. And if they would just start to get adjusted, in fact, chiropractic's made a big push in helping with the opioid crisis. And it's been one of the biggest things that has helped with the opioid crisis. And that's because, again, we're just creating motion in the joints. It really is that simple. If you can keep motion in the joints, you can eliminate and prevent pain from ever coming on. So in the Manga report here, that's what they found, that chiropractic is safer, more effective, and more cost effective for the patients and the country. So they went on to say that chiropractors should be the first, medical doctors should not see back pain patients until a chiropractor has seen them and treated them. And then if there's some need beyond that, then they should go to a medical doctor. And they found out it would save them hundreds and hundreds of thousands and millions of dollars as a country in their healthcare system. So this was a huge report for chiropractic, just like the New Zealand inquiry and the Wilkes trial. There's been multiple times, there's more than that too. Those are just kind of three of the landmark studies, but time and time again, they've done studies to prove that chiropractic is ineffective, or that it costs too much, or that it's not safe. And time again, it proves exactly the opposite. In fact, that's where the best research in chiropractic has come from, is people trying to demean or get rid of chiropractic. It's proven to be the most cost-effective, safe, and effective way to manage low back pain each and every time. So I know that as you guys sit out there, and I talk about our charity that we're working with each week, we're still working with Big Brothers and Big Sisters, and we will be until August 15th. We're doing a school drive. We're taking donations to buy school supplies for kids once they do get to go back. And your $39 donation covers everything in our first visit. We'll have a consultation. We'll take x-rays if we need to. We'll figure out what's going on with you and how we can help you. And then the second day, we'll go over that with you. We'll show you exactly what we can do. We'll show you time commitment, all that stuff, what it's going to cost. We'll answer every question that you have. The $39 for us, we give it to the charity every single time. We just want to try to remove any barrier that's keeping you from taking care of yourself right now, because I know that when I stayed home a little bit more during all this lockdown, I had a little bit of pain because I wasn't moving as much, and that's not good for us. So I got adjusted more frequently, and it's not an issue. But for those of you that are sitting at home, you're achy in the morning, you're sore, you're stiff, you have real low back pain, you have something shooting down your leg, whatever it may be, stop putting up with it. Do something about it. It's just $39. Come in and see us. Let's see what we can do for you. The phone numbers are right here. Give us a call, and we'll help you out as much as we can. But we can't help you if you're not in the office. So get in there. Let us help you. Let us see what we can do. It's going to be safer, more cost effective, and more effective than the painkillers you're taking now, or the Tylenol, or whatever you're doing that's trying to help at this point. So I just want to say thank you guys again. If you have any questions, make sure you reach out to us. Let us know. Put them in the comments. I ask that you just share this with one person. I know you know somebody with low back pain. We all do. So share this with them. Hopefully it can help them. They can get in the office and we can help them out. But join us next Tuesday at 6 o'clock on here or in the office for refreshments and questions to be answered by the docs. Thanks. I appreciate it.